Hello friends, welcome to Awdhesh Academy. Friends, in UPSC you will find that many questions are based on the current affairs topic, and the same is true in respect of your general studies paper 4 or ethics paper. Now today we are going to discuss a case study which was based on the recent pandemic of Covid-19. What are the ethical challenges which we face as a public servant, what we should do? This case study was about that. So let's read the case study. The coronavirus disease COVID-19 pandemic has quickly spread to various countries. As of May 8, 2020, in India, 56,342 positive cases of corona had been reported. India, with a population of more than 1.35 billion, had difficulty in controlling the transmission of coronavirus among its population. Multiple strategies became necessary to handle this outbreak. The Ministry of Health and Family Welfare of India raised awareness about this outbreak and to take all necessary actions to control the spread of COVID-19. Indian government implemented a 55-day lockdown throughout the country to reduce the transmission of the virus. Schools and colleges had shifted to alternative modes of teaching, learning, evaluation, and certification. Online mode became popular during these days. India was not prepared for a sudden onslaught of such a crisis due to limited infrastructure in terms of human resources, money, and other facilities needed for taking care of the situation. This disease did not spare anybody, irrespective of caste, creed, religion on one hand, and have not on the other. Deficiencies in hospitals, bed, oxygen cylinders, ambulance staff, hospital staff, and crematoriums were the most crucial aspect. So far, the situation of coronavirus was basically described in detail. Now actual questions come, and the question is as following. You are a hospital administrator in a public hospital at the time when coronavirus had attacked a large number of people and patients were pouring into the hospital day in and day out. Now the questions are as following. What are your criteria and justification for putting your clinical and non-clinical staff to attend to patients, knowing fully well that it is highly infectious disease and resources and infrastructure are limited? Second part, if yours is a private hospital, whether your jurisdiction and decision would remain the same as of a public hospital? And so these are the two parts, and these questions you have to reply. So friends, in this particular case study, in the first part, the pandemic has been described, how it has affected to the different people. But that is basically to just give you a feel of the situation. The main part is that you are in charge of a government hospital and what steps you are going to take to protect the staff as well as the patient. And secondly, how your role is going to be different if you are in the private hospital. So friends, let's try to answer this particular question. One of the things we should remember that a public servant must serve the public. He has to always work in the public interest, and that has to be kept in mind. But when we go to the private hospitals or any private entity, they don't get the resource of the government. They don't get taxpayers' money. They have to generate their own resources. But nevertheless, as far as the hospital role is concerned, the role is same, that is to protect the life of the citizens. And so to some extent they are similar, but then they are different also. So let's answer this particular case study. Now, as a hospital administrator in a public hospital, I will ensure that the resources of the hospital benefit the largest number of people, particularly the poorer section of the society who can't afford medical treatment in private hospitals. Now friends, as we know that the government hospitals are the only place where the poor can go. As far as the rich people are concerned, they can go to the government hospital as well as the private hospitals. But what we have to remember is that the poor people don't have the resource to go to the private hospitals, and therefore we have to give them priority so that the poor people are not returned back from the hospital, because then they will have no place to go. Now let's talk about the safety of the hospital staff and why the hospital staff must be deployed for this job. So remember that hospital staff must save the life of the patient to best of their ability in the time of such crisis, because that is their job and they have taken oath to protect the life of the people. Now let's first talk about the responsibility as a public hospital administrator. First of all, I will give the preference to the poor and the vulnerable section of the society. I have already explained why, because they can't afford treatment in the private hospital. Since COVID-19 is a highly infectious disease, it's my duty to protect the clinical and non-clinical staff from infection. Now that is required for two reasons. First, the safety and security of the staff themselves, that is my responsibility. And the second thing is that once they get infected, they will infect their family members, they will not be able to attend to the hospital. As a result, the other patients will also suffer, and that is why it is my duty to protect them. So how I am going to do that? I will ensure that all the healthcare staff is trained in washing hands, maintaining social distancing, and wearing proper masks and PPE kits all the time. And proper disposal of the PPE kits and biomedical waste management shall be ensured. Now that should be my duty, because that way I will be protecting my staff as well as the lives of the common people. Now let's talk about the role of the administrator of a private hospital. Suppose I am instead running a private hospital. How my working will change? First of all, as far as the staff is concerned, the role is not going to change. I will take the same steps for prevention of the COVID infection among the staff and the patient. So there, of course, there is no difference. Life is equally important. I will be doing that. But I have to admit the patients who can afford to pay for the treatment or have the proper insurance policy, because ultimately a private hospital is run on money, and so we need those people who can pay for the treatment. But at the same time, we cannot run away from our social responsibility, and therefore I will also ensure that even the poor and the critical patients are taken care by the hospital, and therefore I will ensure that part of the hospital facilities and beds are reserved for the COVID patients. At the same time, I need money also. So what we can do is that I will try to involve the NGOs and use public health insurance schemes like Ayushman Bharat to help the poor and critical patients. So at least partially I can get some money from these NGOs and the government schemes, and that way my hospital will also have fund, and at the same time I can take care of the poor patients of our country. So friends, this is how we have to write the answer of this particular case study. Thank you very much.